You're welcome back. This is Newsfile. It's your most authoritative news analysis platform, and we are discussing COVID-19 rising in Ghana, facts, fears, and stress, staying calm in emergency. So, as you know now, if you have any suspicious situation or for yourself or for some other person, the contact is the emergency line 112. 112. The advice is that you call and you don't just wake up and walk into a health facility. Correct, Dr. Waji?
Yeah.
Great. Okay, so my guests who have been helping us to understand what is going on in Ghana's preparations, Dr. Patrick Abuaji, he's Director General, Ghana Health Service, and Dr. Titus Bayo is Deputy General Secretary and member Infectious Disease Committee of the Ghana Medical Association. Dr. Abuaji will take a couple of questions and then he will leave because he has a very important assignment to attend to having to do with this same situation. So a number of questions have come up, and first wanted to know why put up a new project at Kolebu where there are so many of them that we know were built and are ready for use.
Okay, thank you very much. We are not building isolation centers for COVID. We are decentralizing the services so that every hospital should be able to have a place where they can manage them. And that is why Kolebu has a fevers unit, and I'm sure that's what they are trying to refurbish to be able to use it, so that within the facility, we don't want a situation where it's like a different outlandish area where you are managing them. We may eventually build some infectious disease centers standalone, but that is for a larger group. But for this COVID, we are looking at everybody, whether you are in Bolga, Wa, everywhere, you should have a space where you can.
And this mostly would take the shape and form of, tents.
No tents. No tents. Like I said, we are preparing for the next outbreak. This is not going to be the last one. So we need to put systems in place, sustainable systems that allows us to respond better.
And we're expecting these projects to be done within what period?
You see, funny enough, we have a lot of centers that needed a lot of touch-up. Certain wings and wards and hospitals that could be quickly done in such a way that they can be done there. Some of the cases are being managed at home. So it's really not all of them that will require even hospital care. And that's why we want to build systems across the country.
We know how things happen in this country, Doc. Look, we are watching elsewhere and the system is overwhelmed.
We understand.
Are we certain that we can do these things within time rather than adopt the measures that you find elsewhere? They are using temporary places around the hospitals.
No, we can use temporary places around the hospitals, etc. But we are saying that all hospitals must have a place where they can manage.
Okay.
And we know there are many places that are available that can be used. There's a 13-bed place in Kumasi South. There's another place that can take about 30 in Kintampo and Techiman. And those are all the areas that we need to. We don't want to be carrying everybody into one center.
There's a question about requiring you to tell us, if you can, exactly what support has gone to Noguchi and KCCR to help them do this thing, because they are the only two.
Well, I will not be able to give you, I wouldn't want to give you figures here. Well, we know that there's allocation not only for them to work as it is, but also to scale up our laboratory system for this thing. So those allocations have been made. And
the 8 people we're told are recovering. What can we say about their state?
I don't know where, I've seen that elaborate website, I don't know where that is coming from. We see, when you have a case, even the very first case has not gone through the 14 days. What we do is that when about 3, 4 days to 7 days, when your clinical signs are over, we do a test. If it is negative, then you're out of the woods. If you test and we tested one, it's still positive, we'll keep at a few more days. And so currently we have not certified anybody as recovered.
Mm.
All of them are stable, very mild conditions. Some of them are even being managed at home over 6 or so of them are only ones that are on admission. The rest are at home. And so we have not, there's a certain protocol that you need to go to certify that you are home, you are free, you are
Okay,
go.
so we'll respect the contract. You have to leave now. But a last question from Nana Hesse Ojiri. He says that clearly 80 to 90% of the cases are imported ones, i.e. horizontal cases. And if analyzed, these affected ones entered the country before the president's first nation broadcast. That is 2 weeks before. The question is, how many of such came into the country? This is no longer funny. So, are we thinking about it this way?
Yes, and that's why we started very early with the declaration form to assess risk. And remember that a lot of people were detained at the port and screened. Some of them were taken to facility to test. So those clearly who came with sick and who had significant risk were followed up by phone calls.
Some of them are complaining. We are told of the students at Legon. They are saying that, look, we even food, they are complaining. They are complaining. They feel they could break out and leave.
We will look at that.
You will look at that? Yeah. Okay.
Thank you very much.
Thank you very much indeed. Dr. Patrick Abuaje is Director General of the Ghana Health Service, and we all have to pray and support our health service workers, the clinicians, and all the people involved, because these are not normal times, and they are coming face to face with these cases. You want to say something?
Last word. I think we must agree that this is a health condition that requires a multi-sector response. And that's exactly what is being done. Okay. And we want everybody from the media, transport, everybody to be part of this response. Right. Otherwise, we'll...
Thank you. Thank you very much, Dr. Patrick Abuaje. Dr. Titus Bayo is still with me here, and we would shortly also bring in a next panel to assist us to continue to discuss. But we want your questions to come in. Tell us how you are coping with the shutdown as far as schools are concerned. West African Examinations Council, examinations have also been postponed. This is how this is affecting. We know that people are losing their jobs elsewhere. In anticipation, in the U.S. alone, some close to over 3 million are expected to lose their jobs and to file for unemployment. There are stimulus packages that are being introduced all over the place. How will this affect Ghana's economy? Now, Doc, as we're talking about Noguchi and KCCR and how they could be supported, what do you think? You are asking for a lot more transparency to give us confidence as citizens. Yeah. How do you expect the government to go about this?
Yeah, so in terms of the support for those two institutions, they are critical at this point. And I think last week I made that same point here. We are expecting them to work 24 hours to handle all our samples for us. I think that support is fundamental, because without the testing, we don't know what we are doing. And we'll be working in the dark. So that is fundamental. But I also think that at this point, the testing capacity of the country must increase. And we cannot overemphasize that point. We know that there are mobile technologies that can be deployed where this PCR testing that is being done at these facilities, there are mobile technologies that can be deployed with supervision from these same centers, so that these tests can be conducted at least in all the regional hospitals, so that people who feel they have symptoms, they meet our case definition, or their close contact can be tested, because it's the only way we can help contain this disease.
When you talk about mobile technologies, are you referring to what one of our viewers, listeners, was asking? He said, are there plans to order the rapid testing kits for citizens to test at will?
No, the rapid...
That's different.
It's different. The rapid testing kit, it uses antigen antibody, and it is not as sensitive as the PCR. The PCR is the high-level testing. That is what is recommended for testing and diagnosing everywhere. The rapid antigen will have a role to play. It's just that it can be like a screening tool, because some people will test positive to that who may still eventually be negative. And so if you are using that, then there must be a second level. and that then has to be deployed across the country. People can test themselves, and then those who pick up positive need to go for confirmatory test, which is this PCR. But the PCR is a gold standard for now, and if that is deployed there are mobile technologies for this PCR testing, and that's the one I was referring to, where KCCR, Noguchi, if well resourced, can deploy these mobile technologies for the PCR, supervise it, spread out their staff to help handle this testing at regional hospitals, at our public health reference laboratory. If that is done, then the testing is expanded. Then we can pick up as many people as possible, and then we'll be able to contain the situation. Interesting.
People have been asking a couple of questions about this thing about self-isolation, self-quarantine, the question about also social distancing, which is the most effective, one of the most effective ways to, prevent the spread. They say when you talk that way and the emphasis is like that, you are thinking as though Ghana is the little plush Accra, because you don't seem to look clearly at the homes we are talking about. Compound houses, where you have dozens living together, and they may share, if there's a running tap, one perhaps, and all sorts of things. How difficult are things going to be if the numbers do rise exponentially as you expect?
So in our context, self-isolation will be very difficult, especially for people who live in those setups that you have described, because then it's very, very difficult. If you are sharing, you have a single room, and I put this up on one platform, that if you have a single room where you have a husband, a wife, and maybe 4 kids in there, and you say self-isolate, so who leaves the room and who stays in? These are practical challenges. And that is why, as a state, we must get to a point where people who cannot self-isolate can report to a system that can help them isolate. And that requires a lot of investment. So that if you think that you are exposed, and if you return home, you cannot distance yourself from your family because you all live in just one space, the state should be able to have a system where you can voluntarily go in and then be isolated and cared for there. But to the extent that we do not have such settings, it is difficult. Because if you put it in our context, not everybody can have a room where they can go in and no one will contact them, no one will be with them within, because they perhaps sleep in the same room. Poor ventilation. In some parts of Accra, someone's window opens into another person's house. So what kind of isolation can occur in that setting? But I think that for the public gatherings, we all must respect what has been put out by His Excellency the President and the efforts that we are putting in as a nation, that we should respect this social distancing. And I think more radical measures should be coming up by now. Our public transportation systems. We are sitting in churches where people are still packed together.
That's a very fertile place of spread.
Exactly.
Right?
Once we are confirming community spread, we must have changes there. And that itself will also serve as a deterrent.
The transport owners and drivers are saying unless government is ready to take up the cost, they don't see how it is possible to reduce the number of passengers that they are supposed to take. As if this is just about the president seeking a protection for himself.
No, then we must brace up for a total lockdown, because then if the rule is passed that if, and sometimes people must be forced to protect themselves. That's where the power of the state comes in. Because if people would not obey simple instructions and you are just looking at profit, to what end? You, the driver, you are going to get infected. Your conductor is going to get infected because you are carrying a lot of people and they are not spaced. So I think we must enforce certain rules so that, for instance, we should say only 2 passengers per the row, so that there's that social distancing. Windows must be fully open to ensure aeration within. And if these are not complied with, then the ultimate thing will have to be that transport system may have to be shutting down. And I don't think we want to get there. And if people see the consequences, I think the other thing is we need to carry everybody along.
Right. Thank you very much. Let me introduce our next guest who just joined us and in place of Dr. Patrick Abuaje. Here is pharmacist George Yeboah Kese, Managing Director and Consultant, and George has 15 years of experience in various sectors of the pharmaceutical industry in various roles. A pharmacist by profession, that's what he does, with MSc in Health Services Administration, and currently enrolled in an executive MBA at the Lancaster University. Okay, so there's a lot I can tell you about, and globally, how he's managing certain entities across the, particularly the African continent. Dr. George Yeboah Kese, thank you very much for joining us.
Thank you.
Mr. George Yeboah Kese. Mr. George Yeboah Kese. Thank you very much for joining us. Now, my question to you will be perhaps to start from the point of view of the pharmacist. In the UK, they are beginning to record what we are told is the exponential numbers. As they begin to do that, the state is distributing for free the PPEs to pharmacies. And I ask myself, in Ghana, that is where it does appear what we should be doing first, because many people, their first port of call when they have an issue is to go to a pharmacy rather than to go to a hospital. So what would you say about that as far as protecting those people and in turn protecting everybody else? This show is brought to you by MTN, everywhere you go. Bank of Africa, strong as a group and close as a partner. Amen Scientific, God is the healer. Duraplast, where Duraplast goes, water flows. COAFS, your immune booster. We lead, we build homes for you. And Joy Learning, keep learning. We'll talk about Joy Learning also because it does appear that this is the time that everybody will want to take advantage of the Joy Learning platform. That's the school. So that if your children are at home, one of the first things I did when the President made the announcement about the closure of the schools was to quickly call one of the installers to get one for SHS, student who is now at home. And practically, if you don't occupy them with this, you may never know how it goes. All right, so what do you say? What is the role of the pharmacist in this pandemic? Containment, control, and what can the states do?
Samson, thank you very much. It's true what you said about the UK. In fact, coming this morning, I just learned they are almost running out of paracetamol, which is almost ahead of thing in that part of the world. And that should tell you the kind of seriousness the situation presents now. And frankly, I think in Ghana it's even more precarious for us because with our primary health care, pharmacies are almost the first point of call, especially for the kind of symptoms that this disease presents. And looking at what we've done so far, I must say I'm not really impressed, especially about the kind of coordination that's supposed to come up. Majority of our pharmacy services are provided by the private sector. And that's where government needs to step up now and do a lot of collaboration with our pharmacy service providers. I also expect a lot of leadership from our professional bodies. And this is the time where we expect leadership from all fronts, especially from healthcare workers and our service providers and professional bodies. I expect that the pharmaceutical society should have a way of bringing all the community pharmacy service providers together and putting up a kind of plan on how they are going to engage the public as the first point of call when they walk into the pharmacies. I mean, I've had people call me with symptoms that they've read online, similar to COVID that they're exhibiting, and they don't know where to go. In fact, most of them, the first point of call is the pharmacy, and they are told to go to a hospital. But they should, because the pharmacists don't know what to do when patients walk in, it becomes an issue of should you treat, should you refer them to a hospital, should you tell them to go back home, because this disease does not have a treatment. There's no treatment for it. The only way we can stop this is to get people from infecting others. And so we need to get our pharmacists, especially community pharmacists, up to task on how they can advise people when they present with such symptoms. And I think this is the time a lot of coordination and collaboration is needed, especially between the government and the private sector on this.
Very, very interesting. Now, by the time we started this program at 9 this morning, I was giving you the updates, the coronavirus cases globally. The recorded cases were 277,000 plus. Then when we got to about an hour into the show, it shot up to 278,000 plus. As we speak, it is 279,000 plus. I do this to give you an idea of what we are dealing with and to bring your mind present at home to the preventative measures that we are all supposed to practice. Wash your hands under running water for at least 20-30 seconds with soap. And then, in the absence of that, make sure you have your sanitizers alcohol base, at least 70% alcohol base, 60-70% alcohol base. But washing is the most effective. In the absence of that, do that. Once again, don't touch your face. The most difficult commandment to obey. Do not touch your face, because as you touch your face, we know that the disease, the virus, enters through the eyes, the nose, and the mouth, and it settles at the throat, at the trachea, and also can attack the esophagus. And these are the places when it attacks, it causes you the inability to breathe, because it blocks that opportunity as it mixes with the fluid or the mucus you find there. And you can't breathe out, and you have a difficulty taking in air. We shouldn't get there. So let's practice these precautions very effective. The president had a meeting with the industry players, particularly in the pharmaceutical industry. What good are we expecting out of that? Of course, we have the governor of the Bank of Ghana and other people giving assurances that money will be made available once you are ready to locally manufacture the things that we need. We know that you may not get the PPEs from outside of this country, because those who are doing it need them and they don't have them in good numbers.
So, Samson, I think that was a good start and it sends a good signal. But beyond that, you cannot build systems overnight, and you cannot really isolate your systems from the general situation. So currently, what we have is what we have to rely on. Do we know how much of a drug stock we need to be able to survive through this period? Do we really know how much of stocks of the medications we need available? Do we know how we are going to service people? For example, the disease is mostly very virulent to people who are on chronic diseases.
Right,
so,
Dr. Bayu and
which is
Dr. Puaji just
one of our
that.
growing burdens. I mean, 7 out of 10 middle income to higher income families in Ghana have a chronic disease. So these are the people who are going to put
Say that again. 7 out of 10
middle to higher income families
in Ghana.
In Ghana, they either have hypertension, diabetes, stroke, or cancer.
Okay.
So these are the families who are going to be a burden on our system should the disease get out of hand.
But again, it's important to know that we are learning that whilst initially the idea was that it is the elderly that are most vulnerable and being killed by the disease, the younger ones are also suffering the disease, even though the death rate, as far as the younger people is concerned, is lower.
Yeah. No, and
they spread it more.
Yes, and the thing about this disease is not the death rate. People keep comparing the death rate to cholera, and that's not the problem. The problem is the transmission rate. Because the transmission rate is so high, people get sick and very sick so quickly. So if you look at the extrapolation they've done, even looking at the current case, and I was just using a study that the Harvard Medical School did, based on the current transmission rate that we have in Ghana now, And based on the extrapolations they've done, by the end of 30 days in Ghana, we should expect about 32,000 people with the virus exhibiting symptoms. That's at the current rate of 19 that we have. So if you have 32,000 people exhibiting symptoms and all of them need medical care, just imagine the burden you are placing on your health system.
How do you make these estimations? Sorry I'm asking, but I have followed elsewhere and I see how they make it quite close to what they expect. They know that this number of people will be infected and we should work towards reducing that number or containing a certain number. How did you do that? What you just did?
So based on the latest extrapolation they've done, every infected person that is detected, there are about 10 more that are not detected. So if you even take, and the rate of transmission is 2 times, it doubles every 3 days. So even if you take the people that you've detected and extrapolate that they've infected twice that number every 3 days, you can get quite a fair estimate of the number of people who are walking around and going to start exhibiting symptoms in the next 30 days. And that's very alarming.
Scary.
And the fact is, at that point, you would need a lockdown. Don't forget that in that midst of that lockdown, there are people who need drugs because there are lots of people on chronic diseases. There are people who would also get sick within that period. Just imagine you are in lockdown and your child has a broken arm. The doctors who are supposed to look at you are taking care of COVID patients. And that's where it becomes very stressful on our health system. And that's where it becomes even more stressful on every other sector of the economy. I don't think we should get there.
All right. Dr. Bayo, this is where elsewhere, I think in Ghana, you have also made those announcements. Surgeries and so on have been suspended.
Yes.
Can you explain what that means? Because are you saying that people don't have a life and death situation and you are saying hold on because we have to take care of this situation before?
No, so what we have done seeks to achieve only 2 objectives. The first one is to reduce the risk of transmission in hospital. And the second is decongestion in preparation for higher numbers of people who need care because of COVID-19. And so when you look at the risk, reducing the risk of transmission, we are saying that our outpatient department, for instance, is a very fertile ground.
Right.
People are coming in who are sick and they are sitting there in large numbers in drones and they are very close to each other. So should one person walk in there with a condition, before we try the person and do all of that, that person can infect a lot of people there. And so the outpatient clinics are being decongested. So if you have a chronic condition, we are saying, is it possible we can do an arrangement where you can get a drug refill at the nearby community pharmacy instead of coming to the hospital? If you have a condition, can we schedule your appointment so that we have, let's say, 20 people per time at the outpatient department so we don't have a lot of people? Now, when you come to the decongestion base with surgeries, what we are trying to do is we have what we call elective planned surgeries that are not very urgent, but these surgeries have the potential to populate our ICUs, which is where when we have the severe to critical cases of COVID-19, they'll be managed.
Right.
So if you have a condition that you could have had the surgery in a year, or you can have it in 6 months, why should we do it now at this critical time? So they are the ones that we are asking the surgeries being rescheduled, so that at least our ICU spaces are freed up in case of these critical conditions coming in. Like you mentioned with the Italian situation, it will be very difficult if you have 10 ICU beds and they are all occupied and you now have people with critical to severe disease. Who do you take off? Who are you signing off their death warrant? It will be difficult. So it is a preparatory step that decongests the system. So critical conditions are still coming in. If you need to have your medications that you cannot get from the community pharmacy, or there's a need for a change in dose or anything that you need to see a physician, that access is still there. But we are asking people to deploy ICTs to have an appointment system in our outpatient basis so that there's no congestion. And then the surgeries bit so that we don't populate our ICU space. So that is what that directive or policy is. Yeah.
Interesting. Scary, but we
we are not in normal times.
Like the hashtag is, we should preach calm.
Yeah.
But I say, if we know of the facts, and the facts are difficult facts, we are better off sharing those facts. And if those facts provoked the necessary fear of God in those who must do the right things, we are better off doing it that way than being hush-hush about it, and then we get overwhelmed and perhaps we get damned because health facilities where we know they have the best are overwhelmed.
True.
As we speak. And they are simply choosing who should die and who we want to take care of. How can we do differently and better the situation? Yes, you wanted to say something.
Just to put in, so when people say we are being alarmist in trying to sound the warning, I think maybe they are not really having a good idea of the reality of the situation.
Okay.
This is not cholera.
Right.
This is not Ebola. In fact, this virus is such that it will overwhelm our system. Because it is not a virus.
You are not saying it may, you are saying it will.
It will. In fact, you cannot stop the spread unless you shut down. The only way you can stop the transmission of this virus is to isolate people, because there's no treatment. Hand washing, hygiene slows the spread, but it does not stop the spread. In fact, all the evidence from those who have gone through this, China, Singapore, currently Italy, France, they have to get to a point where they lock everybody down. Because that's the only way you can solve the transmission of this virus. So if it's either we do that now and we bear the consequences, or we do that later when we are overwhelmed, because we will get there.
I trust that we will not get to as much as they have been exposed. It's my prayer, because as I follow, and I follow what's going on in Italy, this should never come anywhere close to us. But 600 dying in 10 hours.
It's not a wish. It's not a wish list. I mean, there are practical measures.
No, there must be something in us that should stop that.
So
because we'll be damned if it happened.
And I think the Minister of Health himself yesterday stated that the truth is we cannot be overconfident about this. Our system cannot cope when we get to a certain level. The honest truth is there. And we all agree. I mean, you were giving us some statistics about the number of ICU beds we have. If we have 30,000 people infected with this condition, if they are all exhibiting only mild symptoms, we are good to go. They will isolate at home, no problem. But if they are exhibiting severe to critical symptoms, at that level where they need a respirator, a ventilator to breathe for them, truth is the system cannot cope. And that is where we are going to have trouble. And that is why I think that we must take drastic measures now. And those drastic measures, we should not think about the politics of it. And I think that when the managers of our system speak the truth to everybody, people will come along, because we know what the future holds for us if we do not. I mean, the examples are there for us to learn from. And I think that if you come out with a clear policy and tell people that, look, we are doing it because of A, B, C, and people know the true situation, that, I mean, I talk about the communication to health workers. As of now, we have some hospitals that when there's a suspected case, people are afraid because the PPEs they need to wear may not be available. So how is that communication? Let us know. In the entire country, we have 10,000 PPEs. We are only giving them when you have a critical or a suspected case. We are not getting any more for now. This is the truth. Then the people understand what is the situation. Then we all can reason out, okay, look, PPEs are in short supply. So only these hospitals can handle the situation. But to the extent that that communication doesn't come, then people feed on whatever information they have. And then
do we have the capacity to improvise in some of these situations? Because I'm looking elsewhere and they are improvising.
There is the need for improvisation, but that also means that, and I mentioned this last week, I made a call here that the NHIA must pay hospitals and pharmacists, because you cannot deprive the people of resources and ask for improvisation. If you manage a hospital, this is the time you want to stock up, and you are owing all your suppliers. How do you stock up essential medications?
What can the pharmacy field, what can you do about, because there is the real danger of not being able to get anything from outside, at least not anytime soon?
So, Samson, this is where it becomes very clear the kind of systems we've built for ourselves as a people. I think I mentioned if we even are aware of the kind of drugs we need to stock up and what quantities we need to stock up. Basic, you need data. To be able to plan, to be able to do anything, you need data. Currently, how our, and he mentioned NHI, which is very significant, how our pharmacies get to stock their drugs is even a problem because the supply chain is so fragmented. So there's no coordination. There's no one who can tell that this drug is needed here at this time.
This is not what I want to hear. This is not what Ghanaians want to hear.
And it's not too late. It can be remedied.
Good.
But we should start now. We should be doing something now. This is where I call on industry captains to put their act together. We need leadership on all fronts on this level.
They should do what exactly?
They should put their members together and form a plan on how they are going to help the community combat this.
That's where you are. You are the lead consultant.
For example,
Royal Crown Consult.
The Community Pharmacists Association.
So don't be saying they should, because you are a key stakeholder.
I am a stakeholder, but I'm talking as an industry player who is calling on our members to do something about the situation.
All right.
I feel the Community Pharmacists Association should come together and find a way of coordinating themselves on how they are going to stock up and provide service. If they should approach the government, and this is where I commend the government for sitting down with industry players, but it should go beyond that. What are they doing to make sure that all the community pharmacies are stocked up, resourced, to help people when they get isolated in their homes with what they will need? For now, there are certain medications that are going to be in high demand, whether for a good cause or not. It is going to happen. Paracetamol, cough and cold medications, these are going to run out. And we need people to be assured that there's a system in place to take care of them when these things come up.
All right. We will take a quick break. And when we return, we would look at, and we would want you to interact with us and tell us how you are practicing the preventative, measures that are being communicated. Use of our trotros. How are you managing the situation? Because we don't have a shutdown, even though that is what the professionals seem to suggest is the way out. But it can be done in certain phases in a way that we are all safe. The cost of very simple things that we need, sanitizers, what is going on? People are seeking to profit so badly in the situation. What can we all do? Veronica buckets, how much did they cost yesterday? How much are they going for today? Why is all of this happening, and how can we reduce some of these situations? Get involved and let's hear from you also. Remember that 112 is the emergency line that is available if there is a suspected case. We'll be right back. This is Newsfile.